They knew my grandma, they knew her personally, in a non-patient role because she was an RN for years, and so it was really just a wonderful caring opportunity. I've been with AHEC for the last 4 years, and it's been an opportunity for me to learn a lot more about rural healthcare, specifically in our small community. I've always had great healthcare provision here in Wellsboro and in the surrounding areas, but understanding how high our physician patient loads are really has brought me a greater understanding of the need to recruit more physicians and allied healthcare professionals to the area so that we can continue to have the great healthcare provision in our rural areas of Pennsylvania that we've had. One of the struggles that we're seeing right now is with behavioral and mental health care, as we note that most of the providers of those services are older. It's an older population. It's not something that we see students going into, where medical students want to go into surgery or emergency medicine. They can really kind of ride in and save the day, and we don't see that kind of enthusiasm for psychiatry. So that's been an initiative of both the state and the federal governments of late. My grandma passed away in February of this year, and I actually was the one who found her in her apartment. So I was there, I covered her up and called 911, and then I was hugely blessed because I am an EMT with Wellsboro Ambulance. So I knew the folks from EMS who came in. I knew the paramedics. I've worked with them before. They knew my grandma. They knew her personally in a non-patient role because she was an RN for years. And so it was really just a wonderful caring opportunity. When we made it to the Soldiers and Sailors emergency room, the treating physician was Dr. Edgar Wong, and he and my grandma had worked together. So he understood her wishes. He was really it was an amazing blessing to live in a rural community and have that level of care and understanding for the person and not necessarily the diagnosis or the billing. When she passed away at the hospital later that evening, we had an amazing nurse who was with us, Karen Gleason, and she stayed with me until my grandma passed away. And it was just such an exercise, an opportunity to see how amazing the healthcare that we have in rural areas can be. And so I just think we're really blessed by that.
It's a very, very difficult challenge to maintain medical doctors' interests in rural health areas. It's a very challenging proposition to get doctors coming out of medical school with $300,000–400,000 of debt to come to a rural area and serve in an underserved area. So AHEC provides a tremendous role in recruitment and retention and communication and allowing our rural citizens to get the proper care that they need from medical professionals. And I want to congratulate them on 20 years of service, of outstanding service to Tioga County and the other counties that they serve.